Joining us is Dr. Peter McCullough, the Chief Scientific Officer of Wellness Company. Dr. McCullough, welcome back.
Thank you.
You know, I laugh at the idea that these people might stand outside the Senate with protest signs. What do those protest signs look like? Are they going to protest trans fat?
You know, that clip you showed of Robert F. Kennedy, I think, were some of the most sincere words America has heard in the last few years. And he honestly and sincerely wants America to be healthy again. And Trump has, with Kennedy, has assembled a team of doctors in Washington to do exactly that. Well, Nobel Prize laureates, have been lauded for their expertise in their fields. None of them have shown concern regarding the health of America, which is in decline. None of them have shown concerns over safety of biopharmaceuticals, the food supply and the water supply. So it's a whole new day now. The focus is going to be on health and safety of Americans. And you know what? Scientific achievements are fine, but they don't have a place when we have Nobel laureates trying to lobby senators on an advice and consent confirmation.
It just seems so tragic that we no longer seem to have award institutions that are as trustworthy as they once were in past, or maybe they've always been like this. Maybe science has always been dictated by money. Maybe big pharma was always dictated by money. Maybe this has always been the way and they're just showing themselves more now. But it reminds me, Doctor, of the time when 51 intelligence officials came out and said the Hunter Biden laptop was not real, and it turns out it was. And this is what this feels like to me. What do you think that RFK Jr. needs to say to any senators who may be on the fence as they consider his nomination?
He's going to meet with them one by one, and I think the senators will be very convinced that he is earnest in his approach, that he has genuine concerns. He very much is a content expert, which is very different from Alex Azar and Xavier Becerra, the previous HHS administrators, cabinet members who are largely bureaucrats. Kennedy is an environmental activist. His interests and concerns are broad, but he has the best intentions for the country. There's no doubt about it. The American Heart Association, the American Clinical Dietetics Association, all of these bodies should come behind him right now, because what he is pushing for is what they have wanted for the longest time: to get trans fats out of the diet, to remove these food dyes, reduce fluoride or eliminate aluminum from the water, the drinking water. All of these can be achieved. We need Kennedy, and we need him to be approved. I don't think he should be making any public statements between now and confirmation, but confirmation, ahead of time, he should have some very important one-on-one meetings with the senators.
Yeah, it seems like there's so much popular support for RFK. He really does transcend party lines with this particular issue, MAHA, Make America Healthy Again. And I imagine that no matter what happens to his confirmation, I believe he will get through, but no matter what happens, I don't see Make America Healthy Again going away anytime soon.
It's been a transformative movement. There's no doubt about it. It's been galvanized. Coming out of this 5-year pandemic period, Americans are ready for change in this area of personal and population health, and RFK is the person to make this happen.
It seems like it. Now, you're the Chief Scientific Officer of the Wellness Company, a sponsor of this show. Thank you. We hear a lot about emerging viruses, especially in this season. People are talking about long COVID still. Is long COVID something that needs to be discussed right now by everyone?
Long COVID is a real syndrome. Probably 70% or more of it's actually caused by the vaccines and having superimposed COVID-19 infection. The body gets loaded with the spike protein. That's the cause of long COVID syndrome. Everybody should have an antibody test against the spike protein to get an indirect measure of how much they've accumulated in their body. Wellness companies come up with a superstar lineup of products, starting with the base spike detoxification, which is now is called Ultimate Spike Detox, a combination product that's the best in class. We have a product to elevate the psychiatric state, lift the mind, improve energy, protect the heart. Most people can handle this with over-the-counter products. They don't have to get into expensive prescription medications, but they have to do something because otherwise they don't get better.
Well, how do you distinguish long COVID from, say, a very bad flu case? I mean, are the symptoms materially different?
They are. With long COVID is characteristic of brain fog. We see evidence of various types of craniofacial syndromes that we don't see with influenza, prolonged loss of taste and smell, provocatory migraine headaches, small fiber neuropathy, and the list goes on and on. It's very different than having the flu. Now, having the flu, one can be knocked down for a period of time and rebound. Long COVID goes on for years.
Years. And you're saying that people should actually test themselves to see the levels of spike proteins in their system. What would you say is like a dangerous level of spike proteins? Is that measurable?
Yeah, we measure the antibodies against the spike protein, which is an indirect measure. The Roche Alexis system is featured on LabCorp. So 0 to 1,000 is considered low risk. That can be just with ambient infection. Then progressively higher than 1,000, we see more and more risk. Those with vaccines can be 10, 15, even over 25,000 units on this test. Vaccinated patients super loaded with the spike protein, and they need detoxification.
Well, I know that you offer at Wellness, you offer kits for people to prepare for various emergencies, national and international, even for people who travel overseas, and you utilize the telehealth, technology to help provide prescription medication. Incredible stuff. What do you recommend people buy now to prepare for this particular winter?
I think with everything going on for the home, the base kit now is called the field kit. It's the biggest kit they have, has the largest array of drugs. It's almost like a home pharmacy. That's very important. And then for travel, cruise travel is best handled by the forest green travel kit. The black contagion kit is what our workers need on farms to help protect against avian influenza. It can handle, people need drugs right away to handle these syndromes. Wellness Company is providing the answers that our government failed to provide when people were acutely sick in the pandemic. We're not going to get burned again. Everybody should get a Wellness Company emergency kit.
Well, it's a great idea, and you're one of the few, I think you're one of the only ones that really provide this service. People have heard from experts like Dr. Peter McCullough. He's one of the more notorious people from the COVID pandemic. He was recently on MSNBC. He was telling viewers that the United States could be hit by multiple pandemics after Trump is inaugurated. Number one, how real is that threat as he has framed it? And number two, what is the Trump administration most poised to do to prepare for that?
The threats are real because they're man-made. They come out of biolabs, and actually there can be leaks, accidental or intentional. And there's higher grades of SARS-CoV-2, which he mentioned, influenza, all different types, Marburg virus, and others. Now, wellness companies position their kits to handle many of these threats. You can actually see the list on the kit information of what would be covered. I think everybody should have one at home. Be ready. Remember, these can be very mild infections if we start treating on day one. If we get way behind on treatment, like with COVID-19, patients can be seriously ill. Since most of the infections are upper respiratory tract infections, I think everybody should have a good nasal spray or gargle. Wellness Company features Immune Mist. That's perfectly fine. Couple sprays twice a day, and then gargle. Typical gargle with scope or Listerine or a throat spray is fine.
Well, viewers, I guess some of you know you advertise with us, and we're grateful for that. You guys can our viewers can find your products and kits at twc.health at OAN. And if you use the promo code OAN, you save 10%. These are excellent products. And Dr. McCullough, as always, we have the great benefit of not only advertising a great product, but also picking your brain on newsworthy topics of the day. We always appreciate both. Thank you for the time.
Thank you.